Chancellor, I, Professor Nana Abba Appiah-Ampho, Vice Chancellor of the University of Ghana, present to you Dr. John Nkengasong, the 2022 Aggrey-Fraser-Guggisberg Lecturer, for the award of an honorary degree, and pray for conferment.
Dr. John Nkengasong, as an accomplished public health and laboratory medicine scientist, you have established yourself as an outstanding global leader in the field. With over 30 years' experience at the forefront of the fight for global disease control and prevention, you have provided strategic and visionary leadership and advice on preparedness to control infectious diseases across the globe. In doing this, you have fostered strategic partnerships and led in devising strategies to deal with the inequalities that have resulted in a polarized world. Your work as an innovator in the field of HIV is well established and recognized worldwide. You established one of the most sophisticated HIV laboratories in sub-Saharan Africa, which was one of the first laboratories in Africa to culture the HIV virus and to map out its genetic subtypes extensively, providing the impetus for characterizing antimicrobial resistance to HIV treatment and developing strategies for reducing mother-to-infant transmission of HIV. As a leading laboratory and biomedical research scientist, your contributions and leadership in advancing global laboratory services and research has been outstanding. Over the years, you have worked to integrate regional surveillance and laboratory networks and helped to establish the African Society for Laboratory Medicine to support African researchers in developing their laboratory medicine capabilities and ability to care for patients. Through your public health, protection, epidemiology, and laboratory research, you have developed innovative laboratory science investigations for the advancement of laboratory medicine in supporting and building sustainable, quality, clinical diagnostic services. All these have culminated in the naming of several laboratories after you and the publication of over 260 peer-reviewed articles and books that have shaped and guided global health policy and initiatives. As the founding director of the African Center for Disease Control and Prevention, you led the agency to prominence as a highly trusted institution during the COVID-19 pandemic, working to coordinate the continent's response. You achieved this by sending COVID-19 diagnostic tools to countries where there were none, setting up a network of laboratories to expand genomic sequencing, creating a pooled platform for the procurement of vaccines, and deploying community health workers and other responders to countries in need. Your sterling leadership, work, and achievements have won you numerous international awards and earned you several accolades, including making Time magazine's list of the 100 most influential people of 2021 and being named African Public Health Champion and Innovation Hero. Dr. John Nkengasong, in recognition of your dedication to public health globally, and in Africa in particular, your contributions to the fight against HIV/AIDS and COVID-19, and the field of laboratory medicine in general, and for delivering the insightful and thought-provoking 2022 Aggrey-Fraser-Guggisberg Memorial Lecture on the theme, Fighting the COVID-19 Pandemic, Africa at a Crossroads. The University of Ghana is pleased to confer on you the degree of Doctor of Science, honoris causa. Thank you.
Dr. John Nkengasong, by the authority vested in the Chancellor, I, Mary Chinrihesi, Chancellor of the University of Ghana, in recognition of your distinguished work in healthcare around the world, and for the role you continue to play in Africa's response to and understanding of the COVID-19 pandemic, I'm pleased to confer on you the degree of Doctor of Science, honoris causa. Congratulations.
Maybe I should honor several people that I represent and symbolize here. This is clearly not a personal achievement, but an achievement or recognition of an achievement of so many people that have worked tirelessly behind the scene to make it worthwhile being here today to deliver this prestigious speech and receive this doctorate honorable degree on their behalf. I'll start by the hardworking staff of the Africa CDC, a young organization that was created just 5 years ago out of the wisdom and the vision of our head of states, the head of states of Africa. In recognition of the fact that disease outbreaks were no longer a health issue, but they were a serious economic threat and a security threat. I recognize their leadership and vision in establishing that young organization and for owning the organization. As I said in the lecture, I have had the great fortune of briefing them more than 18 times. I recognize the partnerships across the continent, and I've shown some of the slides showing you the networks of pathogen genomics across the continent. And without the goodwill and good heart and the true spirit of collaboration and the unity of purpose, we would never have been able to, as a young organization, live up to the expectation. COVID-19 was the baptism of fire for Africa CDC. It was a unique moment. It was never an opportunity to start with. It was a moment whether Africa CDC was going to sink or to swim. I recognize the many universities that have partnered with us, particularly the University of Ghana and the Nguchi Institute. I toured the facilities this morning, and I was delighted to to see the support that Africa CDC has provided, displayed and analyzed and presented to me in the most exciting manner by a young researcher that I cannot remember his name, but I know that he said he analyzed human genetics. That is the power of ownership, the power of leadership, the power of Africa can do it if you want to do it. I recognize my wife, who is finally here. As I said when she was not here, that she took a flight this morning from Addis Ababa and made it here on time to listen to this lecture. But what I didn't tell you is that the reason that we travel separately is that at the airport, they always compliment her. They will say, oh, she looks very beautiful, and is this your daughter? And so I stopped traveling with her. So I said, well, the way to save our marriage is that you travel and I travel so that I don't get those kind of negative compliments. So thank you, dear, for all the support over the last 30 years that we have been married. And our children, where they were all in Washington, D.C. just a few days ago when I testified in front of the Senate, as I had the humbling experience to have been nominated by President Biden as his nominee to potentially head PEPFAR if confirmed by the Senate. And our children, lovely children, were there. It was such a humbling experience. A humbling experience stepping into, if confirmed, into a role that will be defining for our fight against HIV/AIDS, as others have mentioned here. I've spent the last 29 years before I transitioned to Africa CDC fighting HIV/AIDS. And I recall that as a young investigator in Côte d'Ivoire, next door, we were the first to conduct studies to show that by administering zidovudine, a short course antiretroviral therapy, you could reduce the transmission of HIV from mothers to infants by 40%. At that time, public health in HIV was very crude. Remember, the year was probably 1994. There were no drugs to treat HIV. We did that simple study and showed that children could be safe. And at that time, you prick a hip, a toe, a finger of a child, put it in a dry blood spot or filter paper, and then to do the PCR test, the molecular test in the laboratory. So that was then in the mid-90s. And we used to call those dry blood spot specimens. Fast forward, I will go back to Côte d'Ivoire some years later, and those specimens were children that have become teenagers, and they were HIV-free. And today, these children are turning 25 years old. My fear is that if we relent in our fight against HIV/AIDS, those lives that were saved when they were called specimens will be compromised today because they might be infected. If you look at the population structure of the continent, the younger population growing up. So I feel very honored that as an American of African origin, that the President of the United States has nominated me for that position to fight HIV/AIDS, and I look forward to continuous partnership and leadership with the University of Ghana and the Ngugi Institute for the remarkable work that you've done over the years in your fight against HIV/AIDS in Ghana. During lunch today at the Vice Chancellor's place, I asked a simple question about what is the prevalence of HIV/AIDS in Ghana. And I was told, and further asked what the prevalence of HIV-2 was. And Professor William Ampofo said, we've not seen any HIV-2 for the longest. And that gave me hope that together, if we work with initiatives like the US President's Emergency Plans for AIDS Relief, the Global Fund, together with Ghana's own resources, HIV/AIDS may become the past. When the history is written, maybe, who knows, 10 years or 15 years from now, we all remember the long journey that we were accumulating to my personal journey of accepting this doctorate at the prestigious University of Ghana. So I thank you so much for this.